Hello guys, so I'm back with another series. I'm starting the series of specific vaccinations, specifically starting from pediatric vaccination and then moving on to the adult vaccinations as well. So we'll be talking about the age-based guidelines for vaccination and then ACIP and all these things would be in line with the updated current guidelines of the vaccinations, and then the adult vaccinations, and then vaccinations in specific conditions like those who have certain immunocompromised conditions or things like that. So we'll be starting from the very basic, which are the pediatric vaccinations, right? So pediatric vaccinations, first of all, we'll be talking about the hepatitis B, which is of course the most common topic and most important as well. So what do we need to do when the baby is born? So within first 24 hours of life, we have to administer the first dose of hepatitis B, right? Second dose at the age of 1 to 2 months of age, and third dose at 66 to 18 months of age. And there is an important consideration if a baby is born to hepatitis B positive mothers, because we do in first prenatal screening, first trimester prenatal screening, we go for hepatitis B surface antigen testing of the mother to look for if for example the mother is infected with hepatitis B or not. If the mother is infected or test is positive, then what we need to do, what we'll be doing will be administering hepatitis B vaccine plus hepatitis B immune globulin to the newborn. Hepatitis B immune globulin to the newborn, right? The second important consideration is we have to check the mother's status, and then based upon the result, the newborn should be administered in addition to hepatitis B vaccine with hepatitis B immune globulin, right? And the second important vaccination is rotavirus. Rotavirus vaccination, first dose should be administered at the age of 2 months, second dose at the age of 4 months, third dose at the age of 6 months. There is no any other consideration for this, only 2 for 6 months. And still there is one important consideration: if the patient is completely immunized with rotavirus, as the patient gets older and older, immunity can wane across this rotavirus, and in the outbreaks, patient can still have the rotavirus associated diarrhea. But in a children of specifically less than 5 years of age and immunocompromised or immune status is not known or unimmunized, how are we going to determine that category? They'll specifically mention that in the question stem. So if it is not, the patient is not immunized and patient is having the history of, for example, the episodes of 12 to 14 episodes of diarrheas, of loose stools in one day, and the patient is typically immunocompromised by the question stem, or unimmunized, or history is not immunization history is not understood, then in that case the most likely diagnosis would be the rotavirus infection. So another important consideration is that it is specifically contraindicated in those with the history of intersusception, because it increases the risk of intersusception. The only important consideration is this, otherwise we have to administer that at the age of 2, 4 and 6 months.